Okay, I think we can get started. I believe more participants will join as we get going here, so we can start. So I want to say welcome everyone to LAIVF. I have joining me is Dr. Aykut Bayrak. He is the medical director, founder, and owner of LAIVF and has been in practice since 2005. He is a double board certified fertility specialist. And our topic for today's webinar is understanding the difference between IVF, mini IVF, and the so-called natural IVF treatments. There are a lot of different there are a lot of different rumors out there and talk out there about mini IVF and natural IVF. And I think those terms are kind of thrown around in different ways. So we want to be able to demystify what those terms mean and whether it's going to make a different impact on your overall outcome. And Dr. Bayrak, if I'm sure you've heard these terms quite often, and I want to get your take. Basically, that we can start with the definitions between the three.
Yes, so these are fair questions and requests, and there's quite a bit of confusion among patients at times. So let's start with the natural cycle, IVF, which does certainly explain itself. So it's natural, meaning it's done in a natural menstrual cycle. There are typically no hormones, no pills, no injections, no stimulation of the ovaries. The patients are typically followed closely for the development of the natural single follicle egg during that cycle. Hormone levels are typically checked once the egg reaches a certain size. And then once the egg is ready, commonly the trigger is done with a medication, even though it's a natural cycle. That last step is typically controlled, which is a good idea, as opposed to just going completely natural. In which case, we may not know when the egg is being mature, when it's about to be released. So a much better way to do it is as soon as the egg reaches a certain size, as soon as the estrogen level goes up to a certain level, the ovulation is triggered with what we call the HCG shot. And then the patient undergoes the egg retrieval, aspiration of that single egg, and then fertilization is done, embryo is created, and then embryo is immediately placed back into the uterus after 3 to 5 days. So this is called a natural cycle, where it doesn't involve taking birth control pills or injectable medications other than the trigger shot. The benefit of this approach is it's a more natural, I guess, because you're only developing the egg in a normal menstrual cycle. There's no medications involved other than the trigger shot. The cost is significantly lower because it's not a full IVF cycle. Medication cost is minimal to just the trigger shot compared to thousands of dollars typically in the US. So those are the benefits. This type of an approach is really appropriate for somebody on, I would say, on the extremes of their reproductive potential or years. So what that means is that if somebody is really young, let's say 20, 22, 25-year-old person who just simply had maybe ectopic pregnancies and lost their tubes. So somebody who had their tubes removed for some reason, and the only way that they can get pregnant is through IVF. Now, under those circumstances, that person will have, plenty of eggs, healthy eggs, and a natural IVF approach can provide an acceptable pregnancy rate in that individual who's very, very young. The other extreme is somebody who's in the late 40s, or somebody who has low egg reserve in their 30s or early 40s, where she can only develop one egg. No matter what we do IVF, mini, micro, natural, no matter what we do, we just simply cannot develop more than one egg. Then in those circumstances, when the chances are low, clearly, because that person can only develop one egg, natural cycle IVF becomes handy and reasonable, because if you give that person, medications for a week, 10 days, 2 weeks, we're still going to get one egg. So might avoid that cost and stress and injections and hormones and side effects, and just rather do natural cycle IVF. So if you're on the extremes of the reproductive years or situations where you have almost no eggs left, or you have excessive number of eggs, then natural cycle IVF is reasonable. Anybody in between, natural cycle IVF is not reasonable, because it significantly results in a lower pregnancy rate compared to conventional IVF. So for somebody who's in their 30s, who has infertility, maybe has low egg reserve, but they still can develop multiple eggs, conventional IVF is the standard treatment, not natural. So that's natural IVF.
So
go ahead. Sorry, Arba.
So I just want to clarify then, for those who may not, who might be new to this whole process, just to understand, if that is natural IVF, then traditional IVF has, can you explain kind of the different, like the trick, like the shots involved, the medications involved?
Right. So IVF, absolutely. So conventional IVF involves medications, injections. The goal of conventional IVF is to develop multiple eggs. So that's called ovarian stimulation. It takes about 7 to 10 days. Patients typically start with one injection at night. Oftentimes it's increased to 2 after a few days. And a third injection is introduced in the mornings, typically, based on one type of protocol. There are many different types of protocols, but this is the most commonly used protocol, called short protocol. So the goal is to develop multiple eggs and not just one, because one egg may not be good enough, obviously. So when somebody develops multiple eggs, they're typically aspirated, same way like the natural cycle, and then fertilized, oftentimes with the technique called ICSI, because you can sperm, and oftentimes it can result in higher pregnancy, higher fertilization rates, especially in the cases of male factor infertility. And created, and most couples, patients, individuals actually test their embryos these days, because they want to know if they're healthy or not. That test is called PGT, pre-implantation genetic testing, where if you have multiple embryos, some of them are going to be abnormal, some of them are going to be, low quality. And once you do the genetic testing on the embryos, then you can determine which embryo is healthier, and selectively you obviously transfer the embryo into the uterus. So that dramatically increases chances, with or without genetic testing, over natural cycle IVF. So that's conventional IVF compared to natural cycle IVF, where the difference is you're stimulating the ovaries, and you're coming in for maybe 1 or 2 extra visits to the office. You're getting multiple eggs as opposed to one egg. And the pregnancy rates are dramatically higher compared to natural cycle IVF. The exception is that person who can only develop one egg. Because if your reserve is so low and you can only develop one egg, then it doesn't matter if you do conventional or natural IVF, because you're only going to get one egg anyway. So the pregnancy rate in that circumstance doesn't matter. in everybody else, conventional IVF is significantly better in terms of pregnancy rates.
Okay, and that helps out quite a bit, explaining the two. So I think there's a myth also that, or tell me if I'm wrong, that by doing IVF the quote unquote natural way, which you've just described, which is just without the medications, that with medications there might be a chance of harming the woman with a lot of medications, or harming the potential embryo, or there that because the word natural just is kind of used in a funny way in this case. So it almost makes it sound like if it's not natural, that there might be an issue with chemicals or the medications and harm in some way. So can you talk about that?
Right. So that's perception, misperception, obviously. So we wouldn't do anything that would harm our patients, number one. And number two, natural is a funny term. When you do something in a laboratory, there's absolutely nothing natural about that. So natural conception is when you get pregnant through, intercourse. That's natural. So once you take the eggs out and fertilize in the laboratory, certainly there's nothing natural about that. But the concept of using less medications or no medications can serve certain cases, and that can be beneficial. And once again, in somebody who has done multiple cycles and had failed with conventional IVF, who only develops 1 or 2 eggs, no matter what we do, conventional IVF and natural cycle IVF are exactly the same. So in those scenarios, it's it doesn't matter. In terms of the medications, they don't harm the body. They don't increase risk of cancer on the short run or the long run. Hormones can have side effects. There's absolutely no doubt about that. Makes patients pregnant, even though they're not pregnant yet. Can result in headaches, mood swings at times, breast tenderness, perhaps when the estrogen level goes up, based on certain type of protocols. There's a protocol, which is an old protocol called the Lupron protocol, also known as the long protocol. That protocol can result in hot flashes for a few days, which is certainly not fun. So there are certainly side effects of hormones. There's absolutely no doubt about that. But these hormones are short-lived. They have a short half-life. So they kind of come out of the body fairly quickly. The only medication that doesn't come out of the body, which stays for a long period of time, is a medication called Clomid. That's a pill typically used for ovulation problems, or in a different type of IVF treatment, which I will mention in a minute, called micro or mini IVF, where that medication stays in the body and can have prolonged side effects, such as headaches, mood swings, and other hormonal side effects. But short of that, the conventional IVF medications typically do not have long-lasting side effects after you stop them, and they don't damage the body in any way. Let's also touch base on micro IVF or mini IVF. Some people have talked about easy IVF. So there are all these different kinds of IVF that makes everybody confused. So mini IVF means kind of less drugs, less stimulation. That also has been postulated in the past, where if you use lower dose medication, that the egg quality will be better or the outcome will be better. There are studies that looked at that, and it looks like that is actually not the case. So if you use lower dose versus higher dose, lower dose is not better. Once again, the confusion typically lies in cases where if somebody's not responding well to the medications through conventional IVF, You probably don't need to use really high dose medications in those patients, because if you use 600 units versus 400 versus 300 versus 100, you may just get 2 eggs or 3 eggs. So in those cases, mini IVF makes sense because you're just using less medications. But that's not because mini IVF is better. That's because conventional IVF or higher dose medication does not really yield more eggs or embryos. So it's really not the protocol or the mini or the micro or medium size or large or X large, however we like to, shape this or word it so it sounds better to somebody. At the end of the day, it really comes down to the capacity of the ovaries and how many eggs we can get based on what type of stimulation. So in some patients, which is a certain percentage of our patients, where the egg reserve is so low, where if you use a lower dose, you get the same egg numbers. If you use a higher dose, you use the same egg numbers. So it doesn't matter. So automatically that can be called mini IVF. But if somebody can make a lot of eggs, mini IVF versus conventional IVF are, again, vastly different. Conventional IVF will result in more eggs, embryos, more to choose from, more normal embryos, higher pregnancy rate, without a doubt.
Great.
The last is micro IVF. So we talked about natural IVF, we talked about conventional IVF, we talked about mini IVF, and now there's micro IVF to make it, more confusing. Micro IVF typically refers to stimulating the ovaries with pills, not shots, with either a drug called Clomid or tamoxifen or Femara. The last two, Femara and tamoxifen, are cancer drugs. The first medication, called Clomid, is one of the oldest medications for ovulation induction. So once again, if you're on the extremes of reproductive situations, potential egg reserve or age, where you either have excessive number of eggs, but your tubes are blocked, where you would have just gotten pregnant immediately if your tubes are healthy, or if you're in the later years or you had multiple failed cycles, your egg reserve is very low, and no matter what we do, we can only get 1, 2, 3 eggs from you. Then micro IVF, mini IVF, natural cycle IVF makes sense, because conventional IVF and these other IVF options typically result in the same pregnancy rate because we're just getting 1 or 2 eggs. So micro IVF refers to taking just pills, not injectable medications, which is conventional IVF or mini IVF. Patients typically take 5 days of these medications, either the 2 cancer drugs called tamoxifen or Femara or letrozole, or the Clomid, which is kind of the classic pill that we've been using for a very long time. These drugs have different mechanism of action, but at the end, they result in the development of an egg or more than 1 egg. And that's kind of the goal, to get more than 1 egg by using these cheaper drugs that are just pills, no injections, and goal is once again to get more than 1 egg. And then the rest is the same. We aspirate the eggs, we fertilize them, we develop them, and then transfer them into the uterus. So once again, the 4 options for IVF include natural cycle IVF, no medications except the trigger shot, easier, cheaper, appropriate for people who are on the extremes of reproductive age or potential. Conventional IVF is the exact opposite. We use injectable medications. Excuse me. And we try to develop multiple eggs, aspirate them. This is a great option for a majority of our patients, unless they have very few or no eggs left, or they're very, very young in their early 20s. Involves medications. It's more expensive and more involved, certainly, but the benefit is higher pregnancy rate. And then the mini IVF is very similar to conventional IVF. The difference is the dose in the medication. So the dose, but everything else is. And then micro IVF, to sum it up, is the IVF that we do with without injectable medications, but rather with using pills to stimulate the ovaries. Obviously, pills are not as strong, so we don't stimulate the ovaries as well as we like. Therefore, we only get somewhere between maybe 1 to 2 eggs, sometimes 3, rarely. Sometimes it's 1 or 2. So those are the 4 types of IVF that are probably the most commonly utilized. There are some historic types of IVF where there's something called gift, zift, and tets. Eggs would be collected and fertilized or mixed with sperm and injected through the tubes, either on the day of the egg retrieval or the first day or the 3rd day. But those are really historic treatments that, that are used very, very rarely. And compared to conventional IVF, I think in today's practice, there's really no place for them because the outcome significantly over conventional IVF. It's applicable to certain situations, but that is quite rare. So those are all the IVF options. Hopefully our listeners today and in the future through our website and YouTube and other channels will be able to listen, understand, and see which type of treatment is most appropriate for them. But I think the best thing to do would be to come in, do a consultation so we can understand what their needs are and then tailor our treatment or our options based on what they are looking for or what exactly they need.
Absolutely. And our viewers can go to laivfclinic.com, which is our website, and learn more. I do want to also emphasize that any of our viewers can ask a question in the chat box if they like. I have one last question myself, Dr. Bayrak, and that is, how does a woman or a couple, when they come in to see you, how do they know if, what kind of testing do you do to qualify them for natural IVF or mini IVF? What kind of tests are involved in that?
Right, that's a good question. So most of the time for micro, mini IVF cycle, these patients actually have already done IVF and they've already failed IVF cycles. They already know that they have very low egg reserve. So majority of those patients already know coming in to our clinic that they can only develop 1 or 2 eggs. So that becomes an easy answer. However, if somebody comes in for the first time without any prior workup or treatment, just not knowing that reserve is low, then we do our typical conventional workup, which includes examination of the ovaries for egg reserve. That's typically done on the first few days of the period, checking the egg reserve through counting something called antral follicles. On that same day, we do check the reproductive hormone levels and combine the information from those 2 types of assessments and come up with a plan based on their egg reserve. And if we diagnose them with low egg reserve, as long as we can see a few eggs or a few per ovary, we do still start with conventional IVF because our goal is still to get, multiple eggs. Now, in the rare case scenario where we only see 1 or 2 eggs, without any history, without any treatment, without any knowledge that the egg reserve is just so low, then in that case, the discussion can certainly be, about different types of IVF. But in majority of the cases that I see in our clinic, our patients who have already cycled elsewhere in other clinics have failed. Coming in either to get a 2nd, 3rd, 4th opinion, and then we talk about natural IVF, mini IVF, micro IVF, minimal stem IVF. So those are typically more of a common kind of a scenario. But I think the important thing is to understand how the egg reserve is, which is one of the most important variables these days, because a lot of individuals, women, couples, they delay pregnancy compared to the previous generation where they used to have kids in their 20s. Nowadays, you have kids in their 30s, right? And some in the 40s. So that's why egg reserve problems are probably the most common, especially in our practice. That is the most common cause. And if it's on the extreme, certainly these other types of IVF treatment options are, I think, really viable options, understanding that the pregnancy rates are, lower with these options, not because of the option itself, but because of the reason why we're doing IVF.
Gotcha. Well, that's super helpful. Thank you, Dr. Byrak, for explaining the different IVF treatments, and that helps to clarify, the rumors and the talk out there, so that way it's easier to make a decision when they come to an IVF or fertility specialist. And I am just checking to see if we have any other questions, and we don't. So thank you again. Thank you for all who are listening. And those who are listening, you will please give us a call. You will qualify for a free consultation with Dr. Byrak for a 30-minute consultation. And is there anything else, Dr. Byrak?
I don't think so. Different IVF treatments. I think we did cover all, options. As you said, I would encourage our listeners today or later through our website or social media outlets to let us know if they need an opinion from our clinic, if they need any testing, and also determine what kind of treatment option is most appropriate for them.
Perfect. Well, thank you so much, Dr. Byrak.
Thank you. Bye-bye.
Okay, bye-bye.